Tension headaches are the most common type of primary headache disorder seen in practice and perhaps the most misunderstood. The name implies muscle tension or anxious tension is the cause, but this is not accurate. Tension headaches are not related to overcontraction of muscles or anxiety. Rather, the mechanism is an abnormality in neuronal modulation in the trigeminal nerve. The trigeminal nerve carries the sensory input from the face and cranium to the central nervous system and connects to the muscles of the head and vicinity. The trigeminal nerve connections are reviewed in the Med Mastery Neurology Essentials course, but involve pain nociceptors in the cranial structures, blood vessels, mucous membranes, and pericranial muscles. There are central pathways which facilitate pain in the trigeminal nucleus. It is important to note that it is not the brain which feels pain. Rather, it is the pericranial tissues, including the bone and meninges, that have nociceptors which are sensitive to pain. Tension headaches are often bilaterally and are described by patients as pressure-like, vice-like, cap-like, or merely a tightness. Generally, this is around the whole head, including the forehead and back of the head. The intensity of tension headaches can vary, but it is rarely severe and generally is not aggravated by activity. Let's explore the criteria for diagnosing tension headaches. Tension headaches last from 30 minutes to 7 days. Tension headaches have at least two of the following four characteristics: bilateral location, pressing or tightening, in other words, non-pulsating quality, mild or moderate intensity, not aggravated by routine physical activity such as walking or climbing steps. Both of the following characteristics must be met: no nausea or vomiting. Photophobia or phonophobia can occur, but not both. These headaches are not better accounted for by other International Classification of Headache Disorders, 3rd edition, diagnoses, or any other reasonable cause. It is useful to understand the other features which can be seen with tension headache. Pericranial tenderness is elicited by palpation around the cranium. You may need to differentiate trigger points in the temporalis or suboccipital muscles from other cranial structures. There is a close relationship between tension headaches and migraines. The two types of headaches often occur together. The criteria used for tension headache diagnosis is a list of features that excludes the characteristics specific to migraine. The frequency of tension headache episodes is used to differentiate the subtypes. Infrequent tension headaches occur about once a month, but less than 12 days a year. Frequent tension headaches present with at least 10 episodes of headaches per month for greater than 3 months. Chronic tension headaches evolve from frequent tension-type headaches and present with greater than 15 headache days a month.